Hi, my name is Paula Henderson. I'd like to begin by thanking you for inviting me to share my patient's story. My story hopefully illustrates my lived experience of long waits for surgery, frustration with communication between hospitals and the LHINs, and of course long hours waiting in the hallways of the ER. Did anyone else bring one of these binders with them tonight? How about to your last visit at the ER? I asked myself in 2019, how is it that even in states of extreme illness and fatigue, it is incumbent upon me as a patient to bring my own health records with me when I'm seeking treatment? How is it that a digital solution is not integrated across all health systems in Ontario? How is this system putting the needs of patients first? This binder includes all my medical records since I received an open heart surgery in 2010. I bring it with me whenever I have to visit the ER in London. I ask for copies from my family doctor from each episode of care at the hospital, and then I email them to my Toronto cardiology team. This is the only way Toronto General receives any tests from me completed in London hospitals. Between 2010 and today, I have had 5 major surgeries, all risking my health, as I am in heart failure and the anesthesia presents a high risk to my well-being. I have been in and out of the London Health Sciences emergency departments over 17 times. I have been admitted to hospital 6 times since 2012. I've experienced a wait of over 40 hours in the ER while they tried to find a bed to admit me. I've been transported by TVA multiple times and waited in the hall for an average of 14 hours before being assessed. The reality is my health failed due to a magnitude of system failures. I inherited a congenital heart condition from my mom and her mom, my grandma, called hypertrophic obstructive cardiomyopathy. Basically, my heart is too thick and it's harder to pump. In May of 2010, I was sent to UHER by my family doctor, and later I was met with the unfortunate news from my cardiologist that I needed an open heart surgery to relieve the obstruction. This surgery was to be performed urgently at the Peter Munk Centre at Toronto General Hospital, where the type of surgery I required was performed daily. 3 months later, in August of 2010, a sudden decision was made that the surgery had to be performed here in London. I couldn't wait any longer. I was discharged 4 days after an open heart surgery. No home care was arranged. I was still in tremendous amount of pain, and I was not ready to go home, but I did. This was the beginning of what I would learn to experience. I wasn't just a patient, but I now was an advocate for my own care, and I would begin to archive in my binder my health story over the next 9 years. I had begun working in the healthcare sector after I rejoined the workforce in 1996 after the births of my children, starting at the London Middlesex Health Unit, ending up at the Southwest CCAC, now the Southwest LHIN. At the time of my diagnosis, I had worked up my way up from working in client services to become a data analyst and join a senior team of healthcare professionals focused on improving community care for our community's most vulnerable. I made my own home care referral that night in August. Most people don't realize this can be done, but this was the area of healthcare I worked in. I understood the system. I understood the challenges and the barriers faced in home care and long-term care settings. And I also knew the hospital should have sent a referral to the CCAC on my behalf before I was discharged. The horror stories I heard at work with patients being discharged without a home care assessment was now my reality. I was so disheartened that the very agency I worked for missed me in the cracks. If anything I've learned working in healthcare was that communication between stakeholders and clients was of the utmost importance. Why is there still insufficient capacity of nurses and PSWs in the community to support people in their homes? The money the government announced they will be investing is below the rate of inflation. How are these monies going to be translated into more home care for people in this province? Will homemaking be brought back to help keep people safe in their home, conserve a patient's energy, and keep them from declining and returning to the ERs? My binder was becoming heavier. My health was declining. I wasn't able to return to work. I had to sell my house and move to a one-floor apartment. In April 2012, a year and a half later, I had a cardiac MRI conducted, and it revealed that my surgery in 2010 had not been performed properly. So all the hours wasted in the ERs, only be told to go home and exercise, wasn't all in my head. On August 3rd, 2012, at the Toronto General Hospital, the place where I should have had my surgery in 2010, I had a revision of my original surgery, and then I sustained a cardiac arrest. I was sent to rehab in Toronto for 3 weeks. My family doctor and cardiologist in Toronto have been instrumental in my care. If I didn't have my family doctor, Dr. Bayana, advocate for me these years, I don't know where I'd be. My home care nurse has changed 6 times. I've had 5 care coordinators from the Southwest LHIN. So again, my binder is getting heavier and worn, and I'm tired of repeating my story. I cannot overstate how frustrating it is not to have the cooperation between the LHINs in our province. I was told once here at the London Hospital, we don't need Toronto's permission to treat you. And I said, no, you don't. I'm asking for collaboration. I'm asking for cooperation. I'm asking for transparency of my medical records. So I'm resigned to carrying around this binder. I'd like to move on to remind you to ask the right questions to get the right answers. We as patients must speak up to our family doctors, to the doctors in the Emerge, to doctors outside the LHIN, to our MPPs. We must engage with doctors in a way we've never done in the past. We must ask the questions that underline the challenges I have had to face and that patients like me face every day. How can our healthcare system communicate better between doctors, hospitals, and the LHINs? How can we ensure patients receive home care they require, including homemaking, which helps patients stay in their homes, conserve their energy, and keep them from declining and returning to the ER? How can we better maximize St. Joe's urgent care here in London, which can relieve a demand on the ERs and free up time for the Emerge docs to treat patients? Could nurse practitioners be better utilized in our system, in our ERs? An echo done in Toronto should be a source of assessment here in London, and vice versa. Why waste healthcare dollars unnecessarily between the LHINs? How can we reduce the size of the bloated bureaucracy at so many levels within our healthcare to serve patients better? Reinvest these monies for direct patient care. Only through collaboration, transparency, respect, and a patient's first attitude can we restore the healthcare system all Ontarians count upon in their time of need. My faith is strong, and it's kept me afloat during the roughest days. My son Patrick is my rock. Thanks for listening.